Nancy, Gordene, humans, I'm ready. I'm ready. I'm just left here like the animals all the time. Always the humans first. Where are you? Where is everybody?
Lots of people making big, big bucks. You and me, babe, I see we're out of love. Well, I heard a voice from a high above. It don't cost a thing just to be in love. We don't have anything but love.
Hello and welcome to GenderVision, a worldwide program coming to you from Boston's North Shore, dedicated to expanding our vision of the complexity of gender and its impact on our lives.
Today we're going to take a look at sex and gender, and they're not the same thing. And the difference between them can actually be a matter of life and death.
Get ready to meet people who challenge our traditional view of gender and much more.
I'm Gordene MacKenzie.
I'm Nancy Nangeroni, and this is GenderVision, and this is our very first GenderVision together.
Indeed.
Some of you already know us from GenderTalk Radio that we did out of MIT for 11 years, and now this is our new adventure. So bear with us. We're new at this. Hopefully, we're going to make mistakes, but we bring lots of experience in these issues to share with you.
Yeah, this is our very, very first program today, coming from Beverly, Massachusetts.
That's right. So we're going to, basically what we're going to do is we're going to talk about sex and gender. We're going to bring you lots of guests, fascinating guests who've been doing all kinds of incredible work. And we're going to talk about issues that are of importance to the transgender, the gay and lesbian community, intersex, bisexual folks,
feminist, and also women and men, because
Exactly.
oftentimes a lot of people, unless they have to, don't really think about their gender or their sexuality.
Yeah, most people just kind of take it for granted, don't they?
Yeah.
Yeah.
If you ask people, you know, what is your sex or what is your gender, you might get a look from a lot of people in terms of what do you mean.
Exactly, and in fact, even they're conflated now. What does conflated mean? They're confused. Sex and gender are often confused. People tend to think of them as being the same thing, but in fact, sex and gender are two different things. Now, some people like to say sex is between your legs and gender is between your ears, but that's kind of a simplistic thing that always leaves me a little bit uncomfortable. But gender is the way we communicate about our sexuality. It's about how we let other people know that we are a masculine or a feminine person in any of a zillion different ways.
Or maybe somewhere in between.
Exactly.
Or something as well. It's the way that we look, it's the way that we talk, it's the way that we dress, the way we wear our hair. Everything is kind of like a gender billboard out there, don't you think?
Exactly.
Yeah.
And people aren't just one or the other across the board. They're not just masculine across the board or feminine across the board. We have different ways there's a little bit of masculinity and femininity in each and every one of us.
That's right.
Yeah.
And we'll even have Raving Raven on the show. Some of you that have been with us since GenderTalk Radio, Raving Raven's going to fly in and kind of swoop the show up, I'm sure, talking about animal rights instead of human rights, and also the way that gender and sex are in the animal world, which is very different in some ways from the human world, because anyone that's different is not really ostracized.
In the animal world.
That's right. Yeah.
So,
and we're going to have fun.
Yeah, exactly.
That's always a key point, huh?
Yeah, we'll definitely plan to have some fun here. All these things go down a lot easier with fun.
For sure.
So here we are. We'll start out by telling you a little bit about ourselves.
How did we get here, Nancy?
How did we get here, Mackenzie? Well, let's see. We came. First of all, Gordene and I met 10 years ago?
That's right. Yeah.
10 years ago.
At a gender conference.
That's right, in San Antonio, Texas. And I was there as a transgender advocate. At the time, I was executive director of the International Foundation for Gender Education. And Gordene was, at that time?
I was giving a talk. I had done some keynote talks at the Texas Tea Party.
Oh, come on, you're too modest.
Yeah.
Gordene was was probably the leading transgender rights advocate in the Southwest. You'd written a book, Transgender Nation, which still 10 years later is still, more than 10 years later, 13 years later, is still widely referenced for.
That book was basically written by the community and by the phenomenal things that were happening in the 1990s, which was the time when the transgender movement really came into focus.
Yeah, and we'll talk more about the transgender movement, what it is and what it means to people. We know that the word transgender is very much in the media these days, which is a big change from when we both got our start. And so we'll talk much more about that. Not so much on this, our first show, though. We want to start out by talking about sex and gender and the ways in which we gender ourselves and the way in which we gender our bodies, the way in which we sort ourselves into categories based on sex and gender.
You brought some photos for that, didn't you?
I did. All right.
We dug photos out of our archives.
Okay. Can we have that first photo? Let's see. Let's look at this photo. We got a first photo. There it is. All right. This photo is a picture from when I was 5 years old. And that's my sister Mary in the wedding gown there. And I have no idea what the event was. Can we get close up there? But Mary's having a great time, all dressed up in her wedding gown. Can we, let's see the next one. There we go. Yeah. Look at that. And I think there's a caption that goes along with that says, that quotes me as saying, "Aw, shucks, weddings are just for girls," or something. And there it is. Yeah, aw, shucks, weddings just for girls. Daughters, however, like nothing better than to try on the clothing of their mothers. So gendering starts early in our lives, and it certainly started early in my life. And there, I'm already, at the age of 5, definitely experiencing some gender discomfort. Of course, that was back when I was John.
Yeah.
A name that I never really liked that much. But now I'm Nancy. I transitioned in 1993 in Cambridge, made all the papers and all of that. And ever since then, I've been doing activism on these issues. Now, meanwhile, we have another photo, don't we?
I think we do.
Let's see that. Let's see that other photo. There we are.
I think I'm a little younger than 5 years old.
Why don't you do us the honors there?
I think I was.
Oh, bring that back for a second.
I was in my grandfather's house.
Yeah.
And clearly, I'm wearing one of my uncle's or my dad's hat and walking around. And it was a time when my Uncle Dante actually had taught me how to box when I was a little girl.
Guys.
And my Uncle Dante had put boxing gloves on me, and he said he was going to make a little boxer out of me. He said, "Go ahead and hit me." And I was like, "Oh, I can't hit you, Uncle Dante. I can't hit you." And finally, I gave him an uppercut, and I broke his nose. And I was just a very, very little girl. But they were trying to kind of toughen me up a little bit, and I liked it. But the thing with girls is, at a certain age, you're supposed to not be tough anymore.
Once you hit puberty, right?
Yeah. But I always like to keep that sort of little James Dean edge, and I was a little uncertain about my own gender identity. I went through a lot of anxiety, wondering whether I should have been born in a male body, because I was a little wild for the girls that I hung around with, and I got thrown out of the girl pile for drag racing, and so I was kind of in the boy pile. And so I've always had an ambiguous relationship and a chip on my shoulder.
So we both come from a certain amount of rebellion, right?
Yeah,
Sorry about that.
That's right.
Yeah. So that's where we're coming from, and we're here to share a little bit of that rebellion with you, because really, life is too short to stay confined to some rigid sort of trying to measure up to somebody else's idea of what you ought to be with respect to your gender. Too many people go through life thinking, I'm not man enough or I'm not woman enough, and there's so much discomfort around these issues. And I think it's time we all just kind of lighten up a little bit about it all and, enjoy our lives more. it's much too short. Now, you alluded earlier to it can be a matter of life and death. You want to talk about that?
Yeah, I want to talk about that because
that?
we have a culture that is very strict in terms of gender roles, although it's loosened up a lot more than it used to be.
Yeah.
But most people in the early 1990s, the late 80s, didn't even come out of the closet as transgender until they were in their 40s, their 50s.
Now, we haven't talked about what we think transgender is yet.
Sometimes their 60s. You want to go ahead?
Well, transgender. The broadest accepted definition for transgenderism is that it is being transgender means that your gender manifestation in the world, the gender that you show to other people or that you don't show if you're closeted, but you have some amount of feeling about your gender that is contrary to what somebody would normally expect for somebody born with your particular sex, meaning in this culture, meaning your genitals, the particular shape of your genitals. In other words, whether you're born with a penis or a vagina. People expect somebody born with a penis is going to be masculine and engage in masculine things, is going to dress a certain way, is going to look a certain way.
Have certain attractions and follow kind of a course. We have a kind of trajectory where we put people like on a conveyor belt that you're born a male, this is what you're supposed to do, this is how you're supposed to look, this is who you're supposed to be attracted to, and we move that conveyor belt, and you're supposed to get married and create more little yous. Exactly. Just go on and on. But,
exactly. But it doesn't work that way. And likewise for people born with vaginas, you know, they're supposed to be, you know, pretty and cute and sweet and, you know, homemakers and raise families and all, and just lots of things, which aren't bad things. One thing we have to make really clear up front, we're not saying anything, we're not saying that traditional values are bad. We're not saying that it's bad to want, for a person born female to want to be a girl and a woman, to want to be feminine, pretty, any of those things. What we are saying is that it's bad to impose this on somebody. And that's where it becomes a matter of life and death, because people are dying every week. Somebody somewhere is getting murdered, or certainly every month, more than every month, somebody is getting murdered somewhere in this country for being, for their gender not being what somebody else thinks it ought to be. And that's just wrong. And I think most of you out there, most of our viewers will agree with us on that.
Well, in fact, most people do agree now. I think it's like 70%. But in terms of the incidence,
the problem is that 30%.
Yeah,
and
that's
the 10%, and then the 5%. You know, the problem is the fraction. It's you know, most people do agree now, but the problem is you still have some people who get violent about it. Sorry about that.
No, they do, and we're losing one person a month, and we're losing too many kids to suicide. But on the other hand, people are waking up. We have more media representations that are complex.
Yeah.
We see more things, and we're going to show some of those media representations.
And now we have GenderVision.
Yeah, we have GenderVision, and that's...
We're going to change the world.
Yeah, and you know, besides gender, we were talking about the difference between sex and gender. We also have people whose bodies don't conform, just like gender doesn't conform. And our guest today is going to talk about bodies that are different. You know, we make an assumption that every child is born with a clearly defined anatomy, genital anatomy. And in some cases, that isn't always true. And what we've had is we've had a history of doctors who have operated on kids whose bodies are not considered normal. And so today we're really lucky. We have Esther Leidolf.
So we'll be right back in just a minute with our guests. So don't go away.
I'm the bird with the word. I got something to say. Hey, where's everybody at GenderVision? Am I in the right place?
Joining us today, we have Esther Morris Leidolf, and Esther is a medical sociologist and organizer. She's the author of the Missing Vagina Monologue, and she's here today to talk about her experience of being intersex and her identity and also her advocacy work.
Great. Esther, welcome to GenderVision.
Thank you. With all the excitement of trying to prepare for today, I didn't get a chance to actually congratulate you on pulling this off.
Oh.
This is really exciting to be able to actually give gender and the entire gender spectrum the vision that you guys are going to be putting out there through the oncoming months and hopefully years.
Pulling it off is an appropriate terminology, I think.
I think so too.
It certainly beats passing, that's for sure.
Yeah. So we're good.
So.
Yeah.
Well, it's great to have you here, and you know we've talked before.
Absolutely,
We have great respect for the work you do, but let's start off by talking about intersex or intersexuality.
And what is intersex?
What is that? I think most people have never heard of that.
Intersex is a difficult word, and I've gotten to the point now where I actually think of it more as an experience. And it's an experience based on the way people responded to me and to my body, because my body was different. And if I can rewind just a little bit and fill you in on some of the background about my medical history, I was born with a condition called MRKH, which stands for Mayer-Rokitansky-Kuster-Hauser syndrome, which is four men-defined women's anatomy.
Later,
so, yeah, right? MRKH is a whole lot easier to get your lips around.
There you go.
So, MRKH affects people in a lot of different ways. It affects the skeletal system because women with MRKH tend to have scoliosis. Some people have missing ribs or additional ribs or maybe even a plate.
Ribs.
Yeah. Wow. It's interesting, right?
So it's skeletal, or it can be skeletal?
Part of it is.
Okay.
I think with syndromes what happens is that there's sort of like a burp during development. So it's not like things are always genetically inclined or genetically related.
Okay, so it's not like...
Just like all the things that developed at that time just sort of
take a different direction.
Right.
Kind of. And so,
yeah, there was just some kind of disconnect there. So there's the skeletal issues.
Is that like part of the normal natural processes that in part create evolution? You know, because they create a little bit of variation among people.
Absolutely. I mean, if you think about all the things that have to happen to a fetus while it's developing, it's a wonder that any of us are walking upright.
Oh, absolutely.
I don't.
I don't all the time either. I use all fours when I crawl on the stairs.
I know, it's just amazing. So you've got the skeletal part of it. It also affects the renal system. So women with MRKH may have ectopic kidneys. They may have a kidney that's misplaced somewhere. They may be conjoined. There may just be one. They may have a blocked urethra. 10% of women with MRKH have hearing problems. But the most important, I don't know if it's the most important, but the most focused on symptom of MRKH is Müllerian agenesis. And with Müllerian agenesis...
It sounds like a sickness, like malaria.
Well, it's the part of... It's another man's name to talk about women's bodies.
Oh, now see, that's important.
Yeah, but it's the part of your reproductive anatomy that is your fallopian tubes, cervix, uterus, and vagina. So when you have Müllerian agenesis, those parts of your reproductive anatomy don't develop. So essentially, I was born a woman without a uterus, a vagina, a cervix, and fallopian tubes, or at least that's what the focus of my treatment was. I also have back disabilities. I wear hearing aids. I have all these other things that, we'll get to that later. But when this was all
very
discovered...
disturbing when it's about sex.
Yeah, we can't have that. And the message
got to get that straight first, because that's presumed to ruin your whole life.
Right. Well, the message that I got about that was that it was okay for me to be a little girl, and then we discovered this thing about my body. And
how did you discover it?
We discovered it because I was having abdominal pains.
And how old were you?
I was 13.
Okay.
And then they did some examining and poking around and discovered that I didn't have a vagina, or they thought I had an imperforated hymen. So when they went to open the hymen, they realized that there was
no place to open it to.
Exactly. So it wasn't menstrual fluid that was coming out, which is a whole other story. Yeah. So then there was all this falderall around, oh my God, I can't have sex. I was told that I needed to have a vagina so that I could have a normal sex life with my husband when I got married. Can you count the assumptions in that statement?
Yeah.
And let's focus on the
heterosexuality right there.
Yeah, the central one, I just want to spell it out. The central one around that is that the only way to have sex is to insert a penis into a vagina.
Exactly.
And obviously, when there's a lesbian couple, they're not doing that.
Right.
And there's lots of sex, and a lot of straight couples have a lot of sex without intercourse necessarily.
Right.
I mean, oral sex.
All kinds of stuff.
But
and when I talk
did
about this,
anybody
people
ask you?
Nobody asked me. That was until I was maybe 43. But whenever I talk about this, there will always be people who come up to me and they go, you know, I'm really sorry, but you know, I have a congenital vagina and I don't like to do that either. So it's really awful that the focus was so much on vaginal penetration, and and the other sort of health risks of my condition were completely, nobody gave me a diagnosis. They told me I had absence of vagina, congenital absence of vagina, and then it needed to be corrected right away.
Now, Esther, we know for a fact that there has been a lot of unnecessary surgery on persons that are intersex. Can you kind of take us along your journey and,
sure.
and what
can
the
you,
medicalization was?
Yeah, broaden intersex for us, because we've got MRKH, but bring in other.
There's a number of definitions for intersex. There's some that are very strictly medical there, and even though the doctors don't agree on what's intersex, and amongst people with these conditions, there's also various opinions about whether they're intersex or whether they're not, which is sort of when I started thinking of it more as an experience, because we also have different experiences with
so like
our
so
treatment.
much of life, there aren't clear black and white boundaries you can define.
Right. So the most rigid definition is that an intersex condition constitutes anyone who has simply ambiguous genitals, where you would look at the baby and go, is that a penis and a scrotum, or is that a labia and a clitoris? So they can't really tell. Those children are assigned female by default because the surgery is easier.
It's easier to cut something away than it is to create something that's not
I
there.
think the unfortunate quotation that's used is that it's easier to dig a hole than build a pole. Yeah.
Now,
medical panel, that was,
Now these are babies, and oftentimes that surgery is not necessary, so you're not able to give your consent.
There's no consent. It's considered an emergency, so consent actually isn't often required.
What happened with you that way?
The way that it worked out for me was that, you know, I was 13 and 15. I was supposed to be figuring out my identity. I was supposed to be going through puberty. I was having a medical experience. And my parents were also isolated. They didn't have any support for any of this. We didn't have anybody telling us that we had options. So I was simply told that I needed to do this, 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 and this in order to be a woman. So the message that I got was that I couldn't be a woman without a vagina.
And you're young, you're a teenage.
Yeah, you're 13. 13 is not fun.
Yeah. And then you have people telling you have to do all these things that are pretty intense.
Very intense. The treatments are very intense. The other part
you
of
must
that...
have felt really messed up.
Well, that's the thing I was just getting ready to touch on is, you know, all of my friends are having periods and they're, you know, they're going through all these sort of traditional female experiences that I was left out of all of that. It was very isolating. It was very shameful. It's also like embarrassing. I mean, who at 13 is really comfortable talking about their vagina?
Sure.
And people are starting to explore their sexuality. And I
mean, I was cross-dressing in secret, but it was totally private.
Right.
Like I wasn't humiliated by other people.
Right.
Whereas you had doctors looking at you.
I had all kinds of people looking at me.
Oh.
And, you know, and my friends started exploring their sexuality, and I was sort of feeling like my sexuality, well, it's on back order, you know, because I haven't had my surgery, and you can't have sex until you have the surgery. They also labeled me with sexual dysfunction, which was kind of curious because I had discovered masturbation at an early age, and I'm thinking, okay, if I have sexual dysfunction, what made bath time so much fun since the age I was 4 years old? I mean, you know, this was sex for me. So why all of a sudden people are telling me this is dysfunctional when I'm going, yeah, this
works
for me.
okay.
I thought it worked. Yeah, you know, everything's moving around just fine. So, you know, there's all these wacky messages. And
so lots of messages about how your body is wrong.
My body was wrong. It was not allowed to move forward. It was not allowed to mature until I had X, Y, and Z body parts. And they also had to be of a certain size. And they use terminology like adequate vagina, accommodate a penis, and that sort of thing. So
does this happen to a lot of people?
Yeah. MRKH, the statistic is about 1 in 5,000. If you broaden the definition of intersex, the sort of medium ground definition is one that includes people with chromosome anomalies. So there's 5 sort of basic chromosome types and dozens of mosaic chromosomes.
So there's not just 2, there's not just XX
That's exactly
and XY.
right. We're taught XX and XY, but there's XO, there's XXY, there's XYY.
And so there's 5 that are reasonably common?
There's a basic 5 that are pretty common. 1 out of 1,600 people do not have normal chromosomes.
By normal, you mean XX or
XX and
XY.
XY, correct.
So 1 out of 1,600 has something other than XX or XY. That's a lot of people.
That's a heck of a lot of people.
Sure.
Yeah.
And they found that at the Olympics when they began doing testing and
remember
things.
that.
They found that people's
Yeah, they were going to use
chromosomes
chromosomes to keep transsexuals from competing.
Right.
And but they found out that they were disqualifying people who were born men and women who were trying to compete as men and women.
And there are a lot of people that live, never question their gender, never question their sexuality,
Absolutely.
whose chromosomes don't conform.
Yeah.
Well, a lot of people don't realize that they have one of these conditions until they try to have children or something, and then you start doing that sort of thing.
Esther, would you take us to some of the stories that you shared with us about what happened with the medical doctors when you were in the hospital? Because that says so much about the shame and secrecy of intersex. That's forced on them.
Not quite sure.
Yeah, you mentioned when you had your surgery, you had a podiatrist one time come up.
Yes.
That it becomes a medical curiosity.
Yeah, I had people who would just, I remember waking up in the middle of the night once. Now, this was in a time when parents weren't allowed to stay in the hospital. This was in 1972. 72, I had my first set of surgeries. And as much as I'd like to say that things have changed, they have a little, but not a whole lot. So my mother wasn't allowed to stay in the hospital with me. There was really nobody allowed to be there. And I remember waking up in the middle of the night and seeing this light under the sheets. And there was this, and so I kind of woke up and started talking to this guy, and and I asked him, I said, hello, it's like, what's going on? And he said, well, I said, who are you? Are you working with my doctor? And he said, no, I'm a podiatrist, and I didn't think you'd mind.
So
He's
it's like
just
a
out of
peep show.
nowhere.
He just knew that this woman was in, that this kid was in the hospital.
And he just wanted to check you out.
He just wanted to check it out. He said, no, I'm just a podiatrist. And I was just, I just didn't think you'd mind. Didn't think you'd mind. Wakes me up in the middle of the night. He's feeling me up. I woke up to the hand, to the touch of some man feeling my
That should be
legs.
molestation.
Yeah, one would think.
Because he didn't have anybody's permission to do that. He just presumed.
And I was asleep.
Now, there has been an investigation in San Francisco into the medical normalization of intersex bodies, where there was a lot of testimony. The testimonies were given in 2004, I think. And, we hear about cystic fibrosis a lot, but intersex is actually more common than cystic fibrosis.
Right, and Down syndrome combined.
Yeah, but we just don't hear.
Yeah.
Okay.
The broader definition of intersex, and the one that I like to use, is a more inclusive definition, which includes anyone born with any of these medical conditions that someone has decided is not normal. And that's sort of when the intersex experience comes in, because if somebody in authority decides you're not normal, they have the right to fix you.
I remember a story that you told me about little boys that were born, and in order to urinate, it would not be on the top of the penis, but it would be off to the side. So they'd have to sit down.
Correct.
A hypospadias, they'd have to sit down. To urinate, and because it so offended the doctors and they thought it really indicated that they would be more like girls, they put them through surgeries, but they never told them how many surgeries they would have to go through.
Yeah, when they do hypospadias surgeries to lengthen the urethra to the tip of the penis, so that one of the medical goals is so that the child can pee standing up. They don't always mention that they're going to have to do this throughout the kid's lifetime. So you're going to have, the penis is going to grow, so the urethra is not,
Oh
so,
my.
yeah.
Oh, because there's scar tissue and scar tissue doesn't grow.
Correct.
And it amazes me that they can that they can do surgery on someone so small, on structures so small. I would think that it would just be better to wait until they're grown to where the parts are larger, you can work on, and they can give their own consent. They can make their own
there's
decision.
the ownership piece of this is what it sort of boils down to me, and I think that's really sort of what sums up the intersex experience for me, is that when other people, if somebody decides, once they become sexually active, you go, I really would like to have a bigger vagina, or I would like to have a smaller this, or a big, whatever, go for it. We do sort of live in this extreme makeover culture right now. But if people want to do that, and they decide to do that to enhance what they have and who they are, then that's fine.
Yeah.
But when people feel like they have to do it, or when it's being done to them,
when it's
or
being imposed
for
from
them,
outside,
it's not. They don't own it.
Okay, now where can people? Let's talk quickly about books, and you know what? Don't bring the books up. We'll put them on screen.
Sure.
But what are books that people can? What are the 2 or 3 books you'd recommend to folks?
There's a couple of books. There's one that tells stories. It's a collection of stories. It's called Intersex in the Age of Ethics. It's available online.
Yep.
There is Sexing the Body, which is Anne Foster Sterling, and she sort of talks about the whole background of how they came up with some of these categories and some of the sort of contradiction. I mean, we are living in contradiction with our gender and our sexualities.
And the others?
And what would another one? Identity, Intersex and Identity is another one that I would recommend.
And who's that by?
Lessons from the Intersex.
Remember
Lessons from Intersex is Susan Kessler, and the other one is Sharon Preeves.
Okay,
Excellent.
we'll put them up on the screen.
And we'll also put a link to your website,
Sure.
because I know that you work with medical professions and other people, and also help parents kind of go through the thing.
That's mrkh.org, right?
That's right, yeah.
Okay. So we'll
I get a
send
lot of
people there.
emails from doctors asking me for help about how to treat their patients.
Great. You wanted to make some comment about transgenderism? And
I wanted to, but I think I want to say what's encouraging about intersex is that more doctors are encouraging parents to let the kids, if it's not harmful to their health, let them live as they are and let the child make the decision, so they're not going to be disabled much later. But you know, the connection is we're talking about different bodies here. And then we talk about different genders. While intersex and being transgender is very different, there's also some similarities in terms of the shame and the secrecy and the ways that people are treated by the medical profession. And
having things imposed on you by other people or feeling like you have to live up to some artificial standard of what is right for you.
Right.
And the overriding thing here is that we're talking about things that don't matter to anyone else, that are private to the individual. When we're talking about intersexuality, this is about the individual and their own sexuality, and they should be the ones making the decision.
Right.
Likewise with gender. Gender is between you and yourself, and it's up to you to gender yourself.
Right.
And we'll talk much more about that in upcoming programs. We'll look forward to that.
Even on our next program,
That's
we're going to go ahead and do that. And that pretty much does it for today's show,
I think that does it. Thank you very much for watching. We'll see you next time. And
together, we're all going to expand our gender vision. We'll have you meet a lot of interesting people that are going to challenge traditional views of gender.
So thanks so much for watching.
See you next time.
Bye-bye.
Humans.